Hello everyone, in this video I'm going to be talking about the mechanism of edema formation in nephrotic syndrome. First, let's start with the basics. Here is a vessel, and this is going to be the arterial end, and this is going to be the venous end. And let's color this to make it easier for us to visualize. So here I'm drawing the blue color for representing the venous end, and then the red for representing the arterial end. Now, in our capillaries, the way we exchange nutrients and oxygen is through the differences in pressure. So this is a capillary, and outside of it is the tissue. There is going to be two pressures that are really important for exchanging nutrients and gas, and those are the hydrostatic pressure and the oncotic pressure. So hydrostatic pressure in the arterial end is going to be higher than the oncotic pressure, and hydrostatic pressure is the pressure that drives nutrients and gases to the tissue. So remember, the arterial end is oxygenated. So for example, if you want oxygen to get to our tissues, we need hydrostatic pressure to be greater than the oncotic pressure so that we are able to drive that into the tissues. In the venous end, we're collecting waste products. As a result, oncotic pressure should be higher because oncotic pressure is the pressure that is going to draw things to the capillary. So what happens in nephrotic syndrome is that we're going to have a renal injury that is going to result in edema. And there's going to be a couple mechanisms that occur at different times for different patients that is going to result in this edema. First, the renal injury is going to make it harder for the kidney to excrete out sodium. So we're going to have a decrease in sodium excretion. And this decrease in sodium excretion is going to lead to hypervolemia. Remember, water follows sodium, so if we have a buildup of sodium, then water is going to stay. And this hypervolemia is going to increase the hydrostatic pressure. And this increase in hydrostatic pressure is what leads to edema. So here, if we have a lot of increase in this hydrostatic pressure, it can drive fluid into our tissues, causing edema. Now, another reason why there can be edema in nephrotic syndrome is because in nephrotic syndrome, we are going to have a increase in protein excretion, and that's going to lower albumin levels. So albumin is the main protein in our vessels that regulate the oncotic pressure. And if we have a decrease in albumin, then we're going to have a decrease in oncotic pressure. And this increase in oncotic pressure is going to directly contribute to edema. So remember, oncotic pressure is the pressure that drives fluid into the vessel. So if we don't have a high oncotic pressure, then fluid is going to accumulate in the tissue, resulting in edema. When fluid accumulates in the tissue, we're going to have less fluid in our vessels, and then this is going to trigger release of antidiuretic hormone and aldosterone. And the reason for this is the body thinks that it is in a state where it lost a lot of fluid because we have less fluid in our vessels and more in the tissues, but the body thinks that it lost a lot of fluid. So as a result, in order to retain more fluid, it's going to release antidiuretic hormone and aldosterone. So this is a way for, if this is a false way, the body thinks that it needs to release these hormones so that it retains more fluid, even though we have the fluid accumulating in the tissues. And this release in antidiuretic hormone and aldosterone is going to lead to sodium and water retention. And this is also going to result in edema.